Bismillahirrahmanirrahim. I am Muhammad Sadil Islam Sarkar, again in front of you to complete the matters of my previous video that I did not make that matters complete through a single video because it has taken more time. So some matters that I did not discuss in my previous two videos, I will just try to finish those matters right this video. So your patience are required. Uh, 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 During those two videos, I have discussed about the uh, handling procedures, funeral processions, funeral activities before being buried the dead body of a COVID-19 victims. Uh, I will discuss about the precautions that we should take, or what precautions should we take during funeral processions or during funeral preparation of COVID-19 victims. We should take some precautions, including wearing an appropriate PPE, personal protective equipment, such as disposable surgical mask, disposable hand gloves, disposable long-sleeved cuffed gowns, waterproof gowns, leak-proof gowns, also impermeable gowns should be wear. Uh, we can use some eyes protection, appropriate eyes protection such as glasses, such as safety glasses or a face shield. These precautions will be taken due to save from body fluids, from body secretions, or from body excretions that has down through the orifices of the cadavers. Or body fluid secretions or excretions or airborne aerosol from the lungs during post-mortem activities, during the dissection of the dead bodies during post-mortem. To save from splashes, we should take precautions to save ourselves from the splashes or droplets from the COVID-19 victims, to save from body remains, or save from body remains, that means from cadavers. So what about WHO says regarding this handling processing or during handling COVID-19 victims? WHO says wash hands just after handling the dead body of COVID-19 victim with soap and water. Wash hands before eating. And WHO says there is no need to disinfect the corpses before disposal, except in case of cholera. That is very interesting matter that WHO says no need to use any disinfectant to disinfect the dead body of the COVID-19 victims. Just can be disinfected in case of cholera patient. But unfortunately, we are observing that these disinfecting manner, these disinfecting practices have already been done in some cases. We have seen to have some spray on the dead body or on the body bags of the COVID-19 victims. But WHO says this is not necessary because germs are not, virus are not on the body bags. Might be in the lungs, so might be in some organs of the COVID-19 victims. So if you have a body bag used for the handling of COVID-19 victims, so no need to spray or no need to use any disinfectant on the body surface of the COVID-19 victims. One important thing, we have a cautions, we have a curiosity to know about mass gathering or large gathering uh, during burial procession. That means, does a large gathering avoid during buried or before being buried of the COVID-19 victims? Does large gathering avoid during funeral procession? Is a question from we common people that can we arrange large gathering or mass gathering during funeral procession? Some important matters during this large gathering or mass gathering, that large gathering at the crematorium, burial ground, or graveyard or mortuary area should be avoided. Better to avoid. If done, if there have a mass gathering, should maintain social distancing manner, should avoid close contact with the family members and with the friends of the COVID-19 victim, should maintain a considerable distance from the relatives and friends of the COVID-19 victim, and strictly we should maintain social distancing principles. By maintaining social distancing principles strictly, by maintaining minimum 3 feet distance among the peoples, we can allow, but this is very difficult to maintain the social distancing in a mass gathering, so better to avoid. Can friends and family members attend the funeral ceremony? Very important questions. Some people are very curious to know that whether they will attend in their relatives' funeral processions or in their funeral ceremony of their relatives. Friends and family members of a person who has died from COVID-19 infection can attend the funeral ceremony. That means the patients who have died due to novel coronavirus infection, the relatives, the friends, the family members can attend in his funeral ceremony, in his funeral processions. Even WHO recommend the relatives and friends can see or can view the dead body of their beloved ones. Just say have to maintain social distancing principles strictly with using mask. Masks is must for everybody. WHO says the relatives and friends cannot touch the dead body, can't kiss the dead body, can't hug the dead body, or cannot embrace the dead body. That means friends, relatives can attend in funeral activities, but they even they can see, even they can view, but cannot touch, cannot kiss, cannot hug, or cannot embrace the dead body. If a family member does touch the body, he should immediately wash his hands with soap and water or by using alcohol based hand rub. Important thing, another important questions. What measures should you take during handling the body? Again, I'm just uttering this question again, and I just want to share the guidelines from Australian government, Department of Health advice for funeral workers or for funeral directors. What does Australian government say during this funeral procession? Funeral workers and mortuary personnel are less likely to contact COVID-19 if they adopt appropriate infection control procedures and wear appropriate PPE the greatest risk is likely to come from contact with family members. That means if funeral workers, if healthcare workers, if mortuary personnel or funeral workers have wired an appropriate PPE, there is no possibility to be infected. There is no possibility to be novel coronavirus positive after these funeral activities. And greatest risk, what Australian government says, is from victims' family members and from victims' relatives, because there might have some family member in incubation period and has a greater risk for transmission of COVID-19 to the surrounding people. So what about the precautions that has recommended by the Australian government? The following precautionary strategies should be used to minimize public health risk and to prevent spread of diseases. Maintain droplet and contact infection control procedures. The Australian government says, wear appropriate PPE at all times without contaminating environmental surfaces. They have recommended 2 body bags, double bagged, which will have a label written as COVID-19 handled with care. Should be used to prevent leakage of body fluids. In this case, I want to say, and I have mentioned in my previous video, that WHO recommend only a single body bag for the dead body of COVID-19 victim. Pan American Health Organization recommended no need to use any body bag, whereas Australian government recommended 2 body bags, double body bag, to prevent leakage from the body fluids. Australian government also says, avoid unnecessary manipulation. It's a very important matter. Avoid unnecessary manipulation of the body that may expel air or fluid from the lungs. No need to have unnecessary manipulations during post-mortem activities. And they also say, or the government of Australia also say, no need to embalming of a body of a confirmed COVID-19 patient. That is, we know perfuming, coloring is doing in some funeral parlor in some developed countries. They have taken the clotted blood from the dead body and pushing some colors to make the dead body bright in some funeral parlors. It's a general phenomenon in some developed countries. So Australian government recommend no need to have any coloring, no need to have any promulgating or using scent or perfume during the funeral processions in case of COVID-19 victims. Family viewing of the deceased may occur. However, family members should avoid any contact with the body. Maintain the recommended social distance from families and friends of the deceased persons. Australian government also recommends practice hand hygiene practices. Practice hand hygiene practices before and after contact with the body of the COVID-19 patient. Perform regular environmental decontamination, including all surfaces and equipment with a disinfectant. Use appropriate eye protection such as safety glasses or a face shield. Use disposable surgical mask. Use disposable hand gloves. Use a clean protective outer garment. such as a gown. These are the recommendations and precautionary strategies given by Australian government Department of Health advice for funeral directors or funeral workers. So we can follow these guidelines. It's a very good guidelines, and by following these good guidelines, we can arrange our funeral activities, funeral processions, including all. For example, even we can arrange a namaz janaza by maintaining strict social distancing of the gathered people. What precautions should we take during aerosol generating procedures? There is a possibility to have some aerosol or air from the lungs during post-mortem or surgical activities or during the dissection of the chest for post-mortem activities. The potential for airborne spread of COVID-19 is still unknown. Aerosol generating procedures, I have also mentioned in my previous videos about aerosol generating procedures, should be avoided if possible. This is actually not for the general people. This precaution is especially not for the general people. So don't worry. It is for the forensic practitioners, forensic personnel. These precautions are only for the healthcare workers, and airborne precautions should be employed when performing aerosol generating procedures during post-mortem of the COVID-19 victims. Airborne precautions include fluid resistant long sleeved gown should be wear, should use P2 or N95 respirator mask, face shield or safety glasses, disposable non-sterile gloves when in contact with patient, hand hygiene before donning and after removing gloves. Hand hygiene before donning means before arranging and after removing gloves. Keep goggles and try to use cap. So these are all about the funeral activities, funeral processions, and funeral ceremony that should be strictly followed, and it is recommended by the Australian Government Department of Health advice for funeral directors or for funeral personnel, for funeral professionals, for funeral workers. So if we follow this, if we follow these precautions, if we follow this precaution or strategic activities, we can simply arrange funeral procession. We can arrange funeral movement, and we can arrange even funeral program. In some countries, the Australian government prohibited to arrange some coloring, to arrange some embalming for the COVID-19 victims. They are recommending not necessary to arrange this, but this is the common phenomena in some developed countries, that they are arranging the dead body by using some color, by using some perfume, by using some ornaments also. They have ornamented the beloved dead bodies in some funeral parlor. Though we have no funeral parlor in our country, but in developed countries there are some funeral parlor for funeral procession to farewell the dead bodies of their beloved ones. So in case of COVID-19 victims, these are neglected. these are not recommended by the guidelines. So without this, without having some precautions, the main statement, the main message from my video is we can arrange funeral procession, we can arrange burial of our relatives, of the deceased person from COVID-19 victims, uh, by following Islamic rituals, by following religious rituals, and even by saying namaz janaza. We can wash, we can bath the dead body in case of Muslims, and we can arrange namaz janaza by following the principles of social distancing, and by using appropriate PPE. So no more today, more when I meet with you again. I will come again in front of you with some another important topic. So don't misunderstood. This is for the precaution, this is for the awareness, this is for the removing of panic and pandemic situation within we people. So no more today, more when we meet again with some another important topic, inshallah.